Hi, I'm Vicki Liviakis. Welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. With us today, we have plastic surgeon Dr. Joseph Mele, and we're talking tummy tucks. Later, we'll be taking your calls, answering any questions you might have for the doctor. Here's the phone number to call. It's a new one, 415-561-8753. Again, 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, certainly you'll want to consult your own physician as well. Let's just jump right into it. Welcome, doctor.
Thanks. Nice to be here.
I know I opened up the show with the topic of tummy tucks, and that's really what we're going to be concentrating on. But you recently wrote a blog, and this was pretty big news, just back in January, about breast implants, and in fact the FDA issued a white paper about it, about large cell lymphoma. Please talk to me about that.
Right, that was at the end of January, and it hit all the news, and I think it may have scared a few people, so I think it's good to talk about just so we all know what it is and not to be overly worried about it.
Well, you hear lymphoma.
Sure, lymphoma sounds bad, and the reason it's called lymphoma is that's what it looks like under the microscope. So the World Health Organization makes these classifications, and it fits in that picture, but it doesn't act like a lymphoma, and there's actually discussion about making a new subset of lymphoma to include this particular tumor.
Okay, so what happened is that they were seeing the lymphomas occur in some women that had breast implants.
Women were presenting to their doctors with symptoms. So they were having an increase in size on one side and some fluid collecting around the implant. And when the doctor went in there to check it, they found some thickening of the capsule. The capsule is the normal scar around the implant. And normally what we do when we see that is we take it out and we send it to the pathologist to see what it is. And in a few cases, only 34 cases out of probably 10 million, they found this ALCL, this Anaplastic Large Cell Lymphoma. The treatments that were given to these patients were anywhere from the normal treatment from lymphoma, so chemotherapy, radiation, to just cutting it out. And all patients did well. So it doesn't seem to spread, it seems to just grow locally, and removing the tumor seems to be sufficient treatment.
Okay, so the good news here is it's extremely rare.
Extremely
34
rare.
in 10 million?
Yes, and for cancer, quite benign.
Okay.
And the American Society of Plastic Surgeons, we've been trying to catalog these for several years now. It's not exactly new news, but the reason it hit the news was because the FDA came on and wrote their white paper saying that this was not a reason to not do breast augmentation.
Okay, and so the procedure is to take the encapsulation out?
Sure. So basically we're removing where it's growing.
Okay.
And it doesn't seem to have roots, it doesn't seem to spread, it just seems to be removed pretty easily.
And the breast implants are removed, or do you replace them, or what happens there?
It's been done both ways. Breast implants have been removed along with the capsule, and then later the implants have been replaced. Other times just the capsule has been removed because it wasn't really clear what it was. I mean, by the naked eye, it's hard to tell exactly what it is.
Okay, so bottom line in all this?
If you have a problem with your implants, go see your doctor.
Okay.
Because it's probably not this. The most common thing is more along the lines of the scar just getting thick and tight, and it may make the breast feel firm or may move the implant, and that's something that can be fixed also.
Okay, we just wanted to address this, but really we're dealing with another part of the body. We're going to move down
just a little lower.
A little way. We're talking about tummy tucks.